In the next 7 days, as it often happens, they are offering you a discount with a code here. So if you're interested in joining, next 7 days would be the right time. So let me start with the questions immediately. I see there's quite a number of them. Proposed topic, how to help significant others understand and not make things worse. That is an excellent topic. Thank you. I'm going to write it down and I will leave the question open and then I'll copy it later. I will definitely put it. Itchiness triggers me. Yes, sometimes I'm not sure so what the question is, but I'll comment briefly on itchiness. So sometimes itchiness can trigger, and it can trigger in for two different reasons. This is why whenever I hear about itching, I always insist on figuring out what it is. Sometimes itchy skin can be a sign of anxiety. So it can be, let's say, a psychological itch. I'm not even sure if that's a word, but let's call it that. Or on the other hand, sometimes it can be a sign of dry skin or some other skin condition. Both can trigger picking, but the way that we approach them is very different. If it's anxiety, then obviously different forms of relaxation would be a kind of first aid for it. And then obviously working on the psychological side of what it means, why is it that it's causing you to feel anxious and so on. On the other hand, if it's a dermatological thing, then that has to be addressed because no matter what we do, if you have a skin condition, you will always have a trigger that we can't control. So we'll find strategies to deal with it, but at the same time, it's very important to address the just kind of the medical side of it. Should we get rid of our mirrors if that's a trigger? I think that's entirely up to you, and it also depends on what your long-term strategy is. I think you can cover the mirrors. You can use a timer in the bathroom. You can put sticky notes on the mirror. I've had clients who used to print out newspaper articles and then put them on the mirror and then read while they're in the bathroom. So you can also limit your access to the mirrors in that way. When we do this as stimulus control, it's usually not a lifelong technique. So I wouldn't advise you to throw your mirrors away. If you want to, I guess, I mean, you can. They're your mirrors ultimately. But this will be a way for you not to come into contact with the trigger, but it's not going to change your relationship to your skin. So this is something that you will still have to work on. Hi. Well, hi to you too. How can I measure the intensity of an urge? There's no like special scale for that. The app has a numerical value that you can assign based on your own experience. I would suggest for practical purposes, because this is something that I often ask clients and we talk about and we find useful, is that is sort of how intense the urge has to be before you actually have to pick. Because there's usually an intensity of the urge that we can that we can withstand that doesn't necessarily cause you to pick. But then there's that point where you absolutely cannot hold it anymore. And let's say use that as a significant kind of step. So you can have like a lower intensity urge and a higher intensity urge. This is perfectly fine. You don't really have to have a detailed scale to measure urges. The only thing that counts is whether or not they arise gradually or suddenly, so that you know where to look for triggers. Is it one or is it many? And you need to know whether or not it's an urge that's so intense that triggers you to pick or not. And this is a good place to start. I'm not sure if it counts as a trigger, but I believe that for myself, part of the reason why I feel so attached to picking, other than the emotional avoidance, is because touching my own skin stimulates the physical touch that I don't get from others. Everyone needs physical touch, and if you don't get it from others, your brain does whatever it can to replace it, even if the replacement is unhealthy or harmful. Yeah, this makes a lot of sense. I think it also opens an interesting question, which is why is it your touch has to damage your skin? It's kind of, I think, I mean, I don't know you, so I obviously cannot comment about your psyche, but to me, that's an interesting combination because I usually would associate touch with something gentle and nurturing, whereas for you, it turns into picking. I mean, I guess it has the self-soothing component, but maybe that's something for you to think about. And you can also experiment with other ways. There are relaxation techniques that involve you placing your hand on your chest or on your abdomen, depending on where you're upset. There are meditations that make use of this. So there are many other ways that you can use touch in a very healthy and nurturing way. Maybe you can try these out. They could be helpful for picking. But I wouldn't say that maybe the need for touch is the trigger, but it definitely is a psychological need that's perfectly legitimate to have. What about itching? My scabs itch intermittently. I have extremely hard time not picking and scratching. Oh. So I already said a little bit about the scabs. If that's your only trigger or your main trigger, then maybe you can consider, for example, when they start itching, apply, first of all, there are anti-itch creams you can get over the counter, so you don't need anything special for that. You can also use those like hydrating creams and then rub them in instead of picking the scab off, just rub them in very gently, because that will provide some sensory stimulation. And if you use a cream, it will also help your skin heal, because essentially once the scabs are gone, the skin will not itch anymore. So you can use this as a temporary measure. Otherwise, gloves work like a charm for these situations. I pick worse at night when I'm sleeping. I have tried many different techniques, wearing gloves, covering my fingers, etc. Any suggestions to help? Thoughts regarding why this happens? I have attended an inpatient OCD skin picking program and years of therapy, and I have never come up with an answer to determine what is triggering me. Ultimately, they suggest it may have something to do with my narcolepsy, but my sleep specialist and therapists do not agree. So here I sit with no resolution or relief. So I've read a few case reports. Although I believe I've only seen one client who actually that I suspected actually has this. I obviously didn't do any neurological testing in skin pick, but in some neurological journals I found that they have case reports of people who scratch or pick their skin in their sleep, and they explained it as a purely neurological thing. So maybe you can look these up. If you send me an email, I'll remember to look it up for you, and then I'll share the case report that I saw. It's one of those open access articles. I just can't remember where I read it. So maybe that's that. But so I'm not sure that, although this is just a random thought that I have, I'm not sure that I fully understand. Is it at night? So while you're in your sleep. So in that case, the only techniques that would work for you are stimulus control techniques, like wearing gloves and covering your fingers, like you said. I'm sorry to hear that they didn't work, but I would still sort of try and experiment with something along those lines. If there are specific parts of your body that you're picking, that's something that you can also protect. It's very difficult to use any technique when you're not aware that it's happening, so this is like an extreme version of automatic picking. So I'm afraid I don't, based on what I have here, I really don't have anything smart to say. um, if you like, you can email me and write some more, and then maybe I'll have some additional information. But in terms of techniques, stimulus control would be what I could recommend. But it's very difficult to speak about causes since I only know this one paragraph about you. Sorry. Thank you for making this webinar so interesting and diversified project, all because of the art. Well, thank you. When you said you're going to show triggering artworks, I immediately thought about Rhythm Zero, and here it is. Well, it truly is a very triggering work of art. It is extremely triggering, yes. To me, it reveals how extreme things can become when one gets freedom and power. Yeah, I agree. And most people thought that she was the crazy one, whereas to me, that is exactly what the lesson is. Appearing in front of a mirror with a skin picking urge feels just the same, with a difference that it's not art performance and you're the one ready to tore your skin. Yeah, I agree. There's one quote by Marina Abramovic that I really like. She once said that when people do theater, it's ketchup. When they do performance art, it's blood, and that kind of relates to what you wrote here. There were other triggering artworks, but I really didn't want to offend people. Like the Richard Serra's what was the name? The Fluids series. Like some of that would, I'm sure, enrage a lot of people. So I really didn't want to cause a scandal. But Rhythm Zero is one of those triggering pieces that I think were worth showing. I'm glad you like it, because I often find that art can give us nice illustrations of something that would otherwise be too personal, maybe to understand. Sometimes when things are too close to home, we refuse to understand them. Very enlightening, great examples. Thank you. Well, thank you. I'm happy you enjoyed it, because I was quite uncertain about it, because there was no, like, usually when we talk about, I don't know, avoidance, there's a ton of books that I can do, and this had to be constructed from my clinical experience, not from any books or sophisticated theories. often my trigger is an itch where the skin is healing or something that causes itching, like sweating or hair tickling my skin. It's hard to try to ignore it, but as soon as I scratch the itch, I feel the bumps and cannot stop picking until I pick the area and make it smooth. How can I shift focus on treating or preventing the itch when picking is quicker, easier fix? Some of the things you wrote about sweating or your tickling skin can be due to anxiety. So maybe that's something to not could be rather. It may not be the case. So that's something to pay attention to. And I think then the part that you need the most is the last part where, let me see, just one second. I promise I'm not digressing. Just see what topic is leading in the polls right now for next time. It seems like mindfulness of the body and skin picking is leading. Okay, I can put something there for you as well. Well, one way would be to cultivate a different relationship to what you feel on your skin. Basically, it's discomfort that you kind of have to learn to live with. And there are meditative techniques that you can use to do that. So tune in next time if this wins, because then I will be able to offer you some practical techniques. The only catch there is that whatever you use, it's not going to be a quick fix. And that's exactly sort of what my last slides were about, that when it comes to our emotions, there are no quick fixes. We have to simply learn to live with them. I always like, we had that topic once, but it was never voted up for some reason about emotions. In constructivism, I really like the way that they look at emotions because it really resonates with my personal sort of life and also with what I hear with my clients, which is that they see emotions as essentially being information. We treat them as something that makes us a certain kind of a person, but in constructivism, it's just a signal. It's telling you what's happening inside of you. So in that sense, good or bad, that's not the question. The question is what's useful. And through sort of mindfulness and mindfulness-based techniques, we can really sort of try to live this. We cultivate a little more equanimity and body awareness, and this is an achievable goal. Thank you for this. I really appreciate these, as I have struggled to find anyone who understands skin picking's complexities in my area of England. I'm not sure how there is a difference between triggers and justifications. Could you please explain this one? So also your example, I see my ingrown hair on my legs and I want to pick them. During picking, I justify it because then the hair will be out, so they will heal more successfully and then look better in the long run. I can see there is a clear trigger around seeing the blemishes, but then I'm not sure what the justification around future healings are. So I have to say your justification is not exactly logically foolproof, but okay. But so the difference between a trigger and a justification is that a trigger is what causes you to feel. So seeing ingrown hairs, this is your trigger, whatever they may mean to you. I'm not psychic, so I really don't know that just by reading your text. But a justification is sort of how you explain it to yourself so that you don't feel guilty about what you're doing. A justification is borderline an excuse in some way. So, for example, people will often describe how they will start picking because the urge is very intense. Then they will pick a little bit and then a little bit. And then what usually happens is they say, well, now I already picked, so my skin is ruined, so I might as well go all the way. That's a justification. It's what you do to alleviate guilt, because obviously, as soon as you need to justify something, that's basically just like a red flag right there that you're doing something that may not necessarily be unambiguously good for you. So whenever you start justifying it, you should know that there's always guilt creeping in around the corner. So justification basically protects you from guilt. It's rationalization. It's kind of like what someone mentioned about Rhythm Zero and Marina Abramovich's piece. When people explain it and say, well, she's just too extreme, this is basically a rationalization because she's not too extreme. People who tried to kill her were too extreme, So, but you kind of create this structure that flips things in a way that works for you so that you can feel good. And that's exactly what justification is. So when you notice yourself justifying something, think guilt. What about picking when distracted or trance picking? So when distracted, I suppose you mean those that kind of mindless picking. I don't know what about it, so you would need to ask me a more precise question. But regarding trances, we had a whole webinar that dealt just with trances. So you can look it up. There's a lot of material there. It was quite a long webinar. So I'm sure that you'll find, it's just, I guess, a good place to learn about them. I pick and scratch in the middle of the night, only fully waking up and doing something else stops me, picking off scabs. I suppose this is a comment on the nighttime picking. Doing something else stops me, picking off scabs. You have my email here on the left, so you can email me a little bit about how it started and how it's manifesting, and then I'll see if I can help you with more specific details. I came in a bit late. Would you please explain define constructs again? So constructs are just basically these categories that we use to organize our experience, like good, bad. This would be like a nearly universal construct, or rather just words, because in reality, it's a different construct for different people. But yeah, that would be one. Or people who, let's say, I'm making it up just to kind of explain as an example, like being uncomfortable versus being relaxed is a construct that I hear very frequently, and that tends to annoy me because it's very uninformative. Being a good person versus a bad person, that could also be a construct. But usually how you will, like what verbal labels you will attach to your constructs, or whether or not you will attach verbal labels at all to them, it really depends on person to person, because we all have different experiences. And even when we have similar experiences, we draw different conclusions from them. So we put them in different baskets. But it's just a convenient way for us to organize our psychological life. Nothing more than that. I mean, there are very complicated definitions of it, but this is like the simplest thing that I can say. Like Kelly's definition is the way in which two things are similar, but at the same time different than a third thing. Like, you know, it makes everything so clear, doesn't it? What if someone picks continuously? Well, that's not possible. You have to sleep sometimes and you have to eat, so you cannot pick continuously. But I understand that you may pick a lot throughout the day. In that case, if it's focused, it should be relatively easy to identify triggers. If it's automatic, then I would first focus on raising awareness of it by doing something that will disrupt the rhythm, like wearing gloves, for example, or as like a way to learn about triggers, because then whenever you try to pick, it will be physically impossible. So you'll be more aware of what's happening, or like wearing those habit aware bracelets or any kind of noisy, heavy bracelet. All of that could help you be more aware of it. But usually if picking is mindless, then the first step is to become aware of it, because that's the way to learn about triggers. That's the way to stop it, and so on. Why can't we see the questions being asked? I have no idea, to be honest. If this is an issue for people, let me know and I'll try to figure it out. But I thought you could see these questions because I see a list and then I just kind of mark them as answered. I'll figure it out for next time if there's a way. The only thing in that case I would like it is that people would all put themselves as anonymous, because anonymity is a big deal here. So I don't want people to know your identities unless you're willing to disclose. This is why I never read who's asking the questions. Can I see this live again? Yes, you will receive a link to our YouTube channel, I don't know, in a few days. Is picking more like an addiction or an obsession? Is there an approved medicine for it? So picking is similar to OCD. It's considered to be like part of the OCD spectrum. So it's more of an obsession than an addiction. But the reason why it seems like an addiction is because it's very often the only and the most important resource people have to soothe themselves. So if it's the only resource you have, then it feels like kind of you're addicted to it. Like the story of alcoholism and Mark Quinn that I told earlier. Not a question. I just want to say thank you so much for your insight and your valuable time. Have a great evening. Thank you, and you too. Thanks for the webinar. How specific is it useful to be with emotional triggers? I've noticed stress is one of them, but I don't know if I should be more granular in trying to understand that myself and or with my psychologist therapist. What do you think? That depends on sort of what your purpose is. If if stress is enough for you to devise practical strategies and deal with picking, and you don't really want to understand it in more detail, by all means, stay there. I think there's a lot of knowledge and insights and benefits to be gained from being very granular about what you feel. That's what I like to do, and that's how I approach my own feelings. But I understand that some people really might not want to. In terms of this, if you really want to understand sort of it, stress is like a general term. This is a few minutes ago I said how I'm annoyed when people say that they feel uncomfortable. I guess in certain social situations that makes sense to say because you really don't want to spill your guts in front of everyone. But generally, if you're emotional, if you differentiate your emotions on the level of comfortable and uncomfortable, it kind of you basically don't really know yourself very well, because then uncomfortable or stressful can be my annoying boss, or my annoying sister, or sadness, anxiety, anger, depression. All of it's very uncomfortable and stressful, right? And they're not the same things. If you feel sadness versus guilt, they're both stressful, but they're very different. Guilt says you've basically broken one of your values. You've stepped outside of your identity for a second. It's a very big deal. But then anger is just the world's not giving me what I expected to give me. So I'm insisting that the world should change its mind. Like, there's a different message beneath different feelings. Sadness means that you've lost something. Anxiety means that you need more tools. Hostility means that you're actively trying to force the world to be what you want it to be and not what you perceive it to be. So all of them have different, I guess meaning would be too much to say in this situation, but they all have different messages that they're sending you. So in terms of understanding what is it that you need in a certain situation, sometimes it does help to be very granular. If you're sad, maybe you need comfort. If you feel anxious, maybe you need to feel safe. Those are not exactly the same things. And then if you can profile them differently, you can make sure to provide it for yourself. If you feel, if you feel guilt, for example, like it's not the same as you feel sadness. So if you feel guilt, then you need to examine your actions and learn from them, or you need to examine your principles and see if they need to be changed. Whereas if you're sad, you just need to learn how to reorganize yourself to cope with a loss. I mean, internal or external loss, it doesn't matter, but that's what sadness mostly is. So in that sense, knowing exactly what you feel will tell you immediately what's happening inside of you. If you know precisely what's happening inside of you, then you know what kind of a strategy you can devise to deal with that specifically. But if you're looking to do just a kind of behavioral change and stress happens to be useful for you, stay there by all means. What I'm afraid of, so for example, when people mention stress as being a trigger, so sometimes that might actually be the case, in which, and then it's useful to examine it, if it might not be the intensity of the emotions rather than the quality. That's the problem, under quotation marks problem, right? Because sometimes people will pick when they're happy. It's not because they don't like being happy, it's the intensity, like the excitation of your organism, that's what's difficult to deal with. And then maybe it's not that you don't know what to do when you feel guilt, it's that you're having a hard time withstanding the intensity of it. So then all of it can be covered by certain types of relaxation or grounding techniques or something like this. So in that case, maybe you don't need to differentiate each emotion individually. But I guess for some sort of general personal development, it's always useful. This has been an excellent webinar. Thank you for explaining the psychology of it. You're welcome. What if my urge to pick isn't limited to my body? I get the urge to pick the skin of others and pets. I know if I notice blemishes and scabs. Yes, I've seen this on occasion. It happens. There's not much difference in treatment. In fact, if that is the primary way you pick, there's a rather simple way to start, which is to tell people not to allow you under any circumstances to do that. It's a very simple type of competing response. But this happens. There's no particular, like, I haven't noticed anything specific for everyone that I've seen struggling with this. Sometimes it's a question of control, sometimes it's a question of self-soothing, and then people are sometimes the self-soothing effect comes from, let's say, from popping a blemish or something like this, and then it doesn't matter if it's on you or on other people. So it doesn't have to be anything, like it's not a subtype. It's just a different expression of the same thing. Thank you for your webinar. It's been very helpful for me to understand about triggers. Well, you're welcome. How about acne as a trigger? Do you have any advice on that? It's so hard not to pick when your face is covered with bumps. Yeah, so the first thing that I would advise is to see a dermatologist and see how much of it they can reduce and regulate. That would be a form of stimulus control technique, like you're eliminating what the cause of the trigger is. And then the second part would be to maybe start. I agree with you, especially if you have a lot of acne, it is extremely difficult not to pick. Maybe you can start by limiting yourself. This is not something I recommend for everyone, but sometimes people react very well to like saying, I will pick for 2 minutes or one blemish, or to define a specific subtype of acne that you will pick, because acne have different stages in their development. And then, they look differently and feel differently when you touch them or pick them, or some hurt, some don't, and so on. So you can reduce it that way to begin with. But otherwise, so a dermatologist would be a great thing. And then avoiding mirrors, avoiding touching your face. And if you have, obviously sometimes you have to be in front of a mirror, but then use a timer, or depending on your age, if you live with someone or feel comfortable having someone hold you accountable, they can also be close by to help you get out of the bathroom. I had a spot on my face I have picked for over 3 years. It heals, and then I think I see a white spot and I rip it open again. Always at the bathroom mirror before bed. Now I will have a scar. Should I let it heal? There are always ways to get rid of scars. I don't know why I think I have to dig it out or something others would never see it. So if you're going to have a scar there, you picking it additionally is not going to eliminate the scar. In fact, it might make it worse. So whatever you do, try not to touch the scar. Once you first see if you have a scar, you can think about a way to remove the scar. But now it would be very useful to sort of limit your time in front of the mirror, dim the lights. That usually helps, because then you can't see very well. So not every detail will trigger you. And since it's always happening in the evening, I would consider if it maybe has to do with you being tired or stressed. I often notice that people have more tendency to pick in the evenings, because like your stress and anxiety and everything you carry from the whole day kind of culminates there, and you don't have a lot of willpower when you're tired to resist it. So that would imply that, first of all, figure out if that's it. If that is it, then try to find a way to de-stress before going to sleep. But de-stress not by doing something like mindlessly watching the TV, but either physical activity or yoga or something gentle like that, or meditation, or I don't know, progressive muscle relaxation, something that's specifically geared to relax your body. So none of these mental distractions. And then also see how you accumulate the tension during the day, and then see if you can relieve it earlier. 1 second. Okay. Doing mindfulness of the body is dangerous for me. I pick more. I guess that depends on how you approach the exercises and what is it that triggers you there. That's a very complicated topic. It's hard to get into here right now, but I've seen people react, even people who don't pick. Sometimes people tend to react in a very, very sort of very intense, almost aggressive way to body scans. And sometimes, although not always, I'm generalizing now, that has to do with the sense of control, that once people tune into everything that's happening in their bodies and start becoming aware of it, they quickly realize that they can't really control it. And then that's where it escalates and makes them feel worse. So there's a way to approach it to make it gentler. I have been picking since high school, and it has gotten worse as I got older, university and stress. Usually I pick in the evening after washing off makeup in the bathroom. I pick more when the light is stronger, and if the mirror is closer. It usually starts because of acne, and I make the area of the skin worse than it was when I started, and then strong guilt overcomes. It's been over 18 years picking for me and has substantially gotten better. Has or hasn't? But it's still there. Oh, has. Would you suggest CBT? I feel like I almost know my triggers, but not sure how to apply them in practice to manage the problem. So CBT is an effective form of treatment for skin picking. So if you want to try therapy, anything CBT based would be really good. If you want to try working alone, maybe start with our because the so most I guess CBT therapies that are adjusted to picking will have a similar structure that we have at SkinPick, which is the first we start with these simple behavioral approaches, and then we move on to acceptance and commitment therapy and these more, let's say, more sophisticated approaches. So maybe start with the basics, even if you don't find a therapist now. Look at our webinar on habit reversal. That should give you enough to start practicing these very, very basic techniques. And then once you get the hang of that, you can go a little deeper and use more complicated techniques. But CBT, just to not go on forever, CBT should help you, yes. This is my second webinar. I joined the SkinPick program in early January. I'm finding the program very helpful and thoroughly enjoy your webinars. Thank you. Well, I'm glad you find the program helpful, and I'm even more glad you like the webinars. So you're welcome. How do you get out of a trance? So this is, like I said, we had a whole webinar on it because it's a complicated topic. In short, the best way to deal with trances is to prevent them. So find out what leads to a trance and then do whatever you can to prevent it. Because once the trance starts, it's really very difficult for a person to get out of it. You can try doing something slightly more extreme to kind of snap you out, like a cold shower. I'm not joking when I suggest that. That can be really helpful. Or if there's someone around you, they can help snap you out of it. But alone, it's very difficult. You can try breathing exercises, for example. If you do them for 4 or 5 minutes, like box breathing, that tends to be helpful. But with trances, the best thing to do is to prevent them or have someone from the outside snap you out of it. This was very informative. Thank you. You're welcome. The skin picking and other OCD issues like obsessing over physical flaws need to be addressed separately, or would skin pick program address both? Well, that depends. There are some things that we can address. So this, as a program, it's a very kind of narrow structured form of psychotherapy. There are some things that we can address, and we often talk about anxiety or depression, and because there are some practical techniques that we can work with. But if you have my words are clumsy, but like a full-blown OCD, then it might be a good idea to actually separate them because they are very similar and they're like in the same group, I guess you can say, but they are separate conditions. So if you have severe OCD, skin picking might be an easier first step for you, but depending, I guess, on your OCD issues. In skin pick specifically, I would not address OCD as such. So it would be good, for example, if you join the program to get another therapist, or maybe start another form of treatment for OCD and then combine the programs together. I don't think it's realistic to expect that you can treat complete OCD in a program that's so specifically targeted to skin picking. But things like the way you approach your experience, like, I don't know, the way you treat yourself, whether or not you're compassionate or not, anxiety, mood, these things we can address, but OCD is quite complex and requires space dedicated to itself. We see the questions only when they're answered, FYI, but that's fine. Okay, so as long as the reason why I was a little baffled, because I never thought about how it works. I'm good at many things, but technology is not one of them. So I really didn't know how it functions. The only thing that's important for me is not to break anyone's anonymity. As you see, I never read the names, so as long as that remains so, that's fine. Okay. All the names are visible too. Okay, so from now on, I'm not going to be clicking answered questions. I'll just scroll down. Or I will click it on anonymous questions. Not a question, but this is my first SkinPick webinar and it's been great. Thank you so much for being here tonight and putting this together. Very interesting and enlightening. Well, I'm happy you enjoyed it. Join us in March as well, if you have time. If not, then check the recording. Okay, so apparently the list of questions thing was very interesting for you. So let me see. Greetings from Germany. Are there any European resources you can recommend? I really enjoyed this, but it is the middle of the night here. Yeah, I assume that this is not the best time for people in Germany to be listening to webinars. So all of them are recorded, so you can listen to them whenever you like. If you just register, even if you don't attend the webinar, you will still receive, like once you're registered for it, you will receive the link, or you can simply go to the YouTube and find the channel, so you can listen to it anytime. As much as I know, I know therapists who deal with skin picking from Europe. I know work groups, but I don't know any resource like this. One of the reasons why I started the webinars is because I thought a resource like this should exist. So to your question, unfortunately, no. What is a trance? So when we use the word trance, people just mean those intense picking episodes where like that's the only thing that exists. Your focus is entirely on picking and you have absolutely no control over it. So that would be like an extremely intense episode of focused picking. It's just it's not a technical term, it's a colloquial term, but since literally everyone uses it, then I use it too. Do you think group therapy would be helpful for skin picking? It helps to hear others have this. There are some support groups online that I know of. I've had clients who were in both, like in the support groups and in treatment with me, and they found it helpful precisely for that reason, that you get to connect with other people and hear their stories. So I'm sure that it can be very helpful. I don't know of any studies that have tested group treatments, so I can't say that statistically it's good or bad, but I know that people have benefited from it immensely. The only group interventions that I've heard bad things about are I've heard from a few of my clients that there are like 12-step groups for body focused repetitive behaviors. And then they seem not to be efficient. But again, this is just like anecdotal evidence. So I don't think I would take it as seriously. Ultimately, if it doesn't cost too much, you can try and then see if it works for you. Because sometimes, like for example, people often ask me about hypnosis. Like there's absolutely zero evidence that it helps with anything in terms of clinical studies and stuff like this. But on the other hand, I have had clients who really found it helpful. So ultimately, even if there is no scientific evidence for something, it doesn't mean that it doesn't work. It just means that there's no evidence for it. No one has tested it. Science tends to be a little jaded sometimes. So nowadays, if something is not CBT, most therapists will just not bother with it. And it doesn't mean that it doesn't work. For example, I remember back when I was in medical school, people used to frown. And today, I have to say, a lot of psychiatrists and therapists frown on psychoanalysis. And they used to say, no, that doesn't work, that doesn't work. And the truth is that, yes, it does, but psychoanalysts have kind of an aversion to empirical evidence and kind of generating the evidence based, so they never bothered with it, right? They don't even operate in the medical mainstream anymore. They have like their own little system, so they don't care. But then when studies started coming out, and studies that would test the neuroscience behind psychoanalysis, like how it affects the brain and outcomes, well, it turns out that for some things, it's far more effective than CBT is. Again, ultimately, it really matters whether or not it works for you. So I wouldn't always think that because there's no evidence for something that it doesn't work. But I feel obligated as a therapist to say that there's no evidence, because when I recommend something like to a general public, let's say, then I want to have at least some evidence that it works. So I don't know that group therapy works, as in like there's no studies that I'm aware of, but you actually might benefit from it. So if you can, try it and then see if it works for you. I guess this is my constructivist nature speaking, because in constructivism, ultimately, there's no theory that will tell you what's true. You have to try things and then you can see if they work. So that's how I approach therapy and life. I skin pick, but also have been pulling my hair. Are they the same in light of what you have spoken regarding triggers? Is pulling out the hair the same as skin picking in general, being that I go back and forth, creating a seemingly more complex problem for me? Oh. So they're not exactly the same, but they fall in the same category of what we call body focused repetitive behaviors. So they have different clinical presentations because one obviously involves picking your skin, the other pulling your hair, but the mechanisms behind them are very, very similar. So everything that you learned about triggers today, I'm absolutely certain can be used for hair pulling, no doubt whatsoever. So yes, you're welcome to. Actually, I've had clients at SkinPick who pull their hair and then they just join SkinPick and it works just as well. So to your point, they're not the same, but they are very similar. I'm just looking outside to see what time it is. Let's see if we can answer one or two more questions. Can you recommend any resources for treatment of other types of body focused repetitive behaviors and or individuals with features not of OCD but of obsessive compulsive personality disorder? So for other types of body focused repetitive behaviors, well, like I just said, basically anything you learn here, you can apply for any type of BFRBs. Habit reversal training is designed for BFRBs. So basically any type of repetitive behavior you can treat with that. The company that has this program has a program for trichotillomania. It's called TrickStop. So you can you can try that. It's also very similar to this because they are similar programs. And in terms of personality disorders, they tend to be difficult to treat because they require time to treat. So what I would recommend is standard face-to-face or Zoom to Zoom, whatever works in the times of pandemic, like psychodynamic therapy. Because typically, when it comes to personality disorder, psychodynamic and insight-oriented therapies tend to work better. The, because the treatment usually has to last a long time and insight is quite important. So that's basically what I recommend. And if you, in terms of just specific OCD, CBT should work fine. It is 4:25 in Iran, and I stayed awake for this webinar. It was really worth it. I'm glad you did, but my God, maybe you should consider sleeping and then streaming it on YouTube. But thank you. I mean, it's a beautiful compliment, and I'm glad you enjoyed it. Is skin picking and inside mouth biting in the same category? Dermatillomania could it be treated the same? Yes, it can be treated the same way. It falls in the same category. Biting inside your mouth obviously requires different techniques, but same principles apply. Thank you so much. You're truly amazing. Oh, well, thank you. You make me blush. Your frankness is so helpful. While you never condescend, I so appreciate this. Looking forward to the next webinar. I'm glad, and if I ever sound condescending, I will slap myself because if there's anything in this world that I hate, it's when people are condescending. So thank you. That really means a lot. So not skin picking, but hair pulling. My child says, my child says my saying good job not pulling is a trigger. I think that happens to me with picking too. Yeah, that happens sometimes because especially if your child is young, like one of the things that children almost universally want is just to be good kids. And then this reminds them that sometimes they're not, or it puts additional pressure on them. So it's not that you shouldn't validate, just maybe find a way in which your child will be okay with it. Because validation helps reinforce behaviors. I always tell clients, like, reward yourself when you have a day without picking or a week without picking, because that's a big deal. But yeah, I guess maybe the question is, what would be a good reward for your child? Maybe ice cream. Maybe I'm just hungry, maybe. But yeah, so that makes sense also. If you need me to give you any other specific advice, I mean, just ask a more specific question. I think my brain is a little tired now, so I'm not sure if I'm picking up on the on the question correctly. Thank you very much for being so generous with your time, knowledge, and insights. Best wishes to you and yours. Well, thank you, and you're welcome. I only pick in my car, and when I stop doing all my day, then I obsessively do it. So I'm embarrassed, and I eat scabs. That's quite common, so there's no need to be embarrassed about it. I mean, I see that with clients often enough. Uh, Shame usually never leads to change. So if you can I will not mark this as red so that you remain anonymous now that I've learned this. If you pick in your car, then stimulus control is usually a great way to go. Keep a pair of gloves or finger covers in the car, and that usually works. It's like very rarely that this doesn't work. And so the rest, when you wrote, I didn't quite understand what you mean by doing all my day, then I obsessively do it. But I guess you mean like after you finish everything for the day. I think I already maybe gave you some advice before when I talked about sort of how to track your stress levels and how to catch your urges before they become so intense. Because when it happens in the evening, it's usually a cumulative effect of what has been happening throughout the day. So then the best way is to cut it in its root, which is to reduce stress as it's happening. Because usually, I mean, we all have stressful events during the day. Like even when things are nice, they take a toll on us. And then each individual event is usually manageable. But when you have 10 of them in a row and then you come home, usually that's difficult to manage. So if you change the way you relate to stress, pay more attention to it, track anxiety, see where your boundaries are, say no to things, incorporate breaks when you work and stuff like this, that can usually reduce the evening picking by quite a lot because there's less pressure and there's less tension in your body. Okay, so let's stop here. Uh, I've answered now when I see quite a number of questions, and we've been here for 2 hours at this point. So before we go, let me see what the topic will be for next time. So polls have closed, and the winner is mindfulness of the body and skin picking by just a bit. So the next topic would be anxiety and relaxation techniques, basically like one vote, one. So I'll see if I can mix in something about anxiety and relaxation, because when we talk about mindfulness of the body, relaxation is not far away. So I will try it because one vote difference. I will try to combine the two and then make one webinar out of these. I will also add the topics that were proposed so that you have a new poll next time, and have a lovely evening and see you in March. Bye.